Claude Brunson. How are you today?
I am doing fine. How are you, Dr. Outler?
I'm fine. Thank you so much for making time to speak to me for Uzima Health and Wellness. I know that you're very busy, so I do appreciate you carving out some time to talk to me. I've been asking you because, of course, Jackson, Mississippi is hot for a number of reasons. And just not to put in a plug for P-Valley, but that was one of the things that happened this year, this series. But you all have a serious time right now. And I thought as a physician, someone who you have mentored distinctly, that would be me, that I wanted to have an opportunity to offer you a time on this platform to talk about some things in Jackson, Mississippi. But I first want to let people know who you are. You are the president of the state. What I'm going to say, you are the president of the Mississippi State Medical Association. And you are
I'm the executive director, the CEO of it. Yes.
Oh, let me let you say that again.
Executive director, CEO of the Mississippi State Medical Association.
And you are the first.
I was the president of the Medical Association in 2015.
And so you are the first Black man to hold both positions?
Yes.
Okay. And you've had a lot of first in the state of Mississippi for when it comes to executive medicine, a lot of first.
Yes.
You've been advisor to the vice chancellor for the medical center.
Yes.
And some other firsts include the first African-American to lead an anesthesia department.
Yes.
Hence, that's how I know you, and you inspired me to become an anesthesiologist. So, I know your resume is very long, but I want to also remind people that you have served your country and you've served your country well. You were also in the Navy, in the United States Navy.
I was.
And I work for the military, so I know what it means to say you worked yourself up from a Navy corpsman and then became a physician and brought your talents to the University of Mississippi Medical Center for your whole career.
And I did spend my entire medical career there.
So I mean, what that means, what that says to me is the dedication that you have not only for medicine, but the dedication that you have for the state and for healthcare for the people of Mississippi. So I can't think of anybody right now to interview that can be an advocate, a better advocate for the state of Mississippi and this healthcare.
Well, thank you. And let me just start out by thanking you for allowing me to come on your show. I'm so proud of you and all of your achievements and the opportunity to sort of speak with you about some of the things that we're dealing with here in Jackson, whether it be our water crisis or healthcare in our area. Obviously, those sort of combined. Without good, clean water, you are going to have public health issues. And so they sort of intertwine there appropriately.
They do intertwine, but let's bring up something that put something out front that I don't see on the news cycle. And as a physician, you all have to do more with less in the state of Mississippi. We always want to kind of talk about the indices of Mississippi, but we need to first of all take our hats off to a state that has the wherewithal to continue to do more with less and provide good health care to the state of Mississippi patients and population. Tell us about the University Medical Center, University of Mississippi Medical Center. Describe what you are for the state.
Yeah, well, the University of Mississippi Medical Center is the only academic medical center in the state. Up until about 10 years ago, we were the only medical school in the state. About a little less than 10 years ago, another medical school, osteopathic medical school, started down William Carey University for Osteopathic Medicine. And they have actually been doing a fantastic job. They put out a lot of primary care physicians for the state, which is what we need. And they've expanded their class size to 200 just recently. But at the university, we have a class size of about 165 students. We have all the different residency programs that any academic medical center would have. We are a tertiary level hospital with the only level 1 trauma center in the state. And we have a lot of services that don't exist anywhere else, such as our transplant programs and those high level services that you would expect to get at an academic medical center and a research center. And so that's basically what UMMC is. It's the only of its kind in our state. It's a regional facility. We do some things at the center better than a number of places around the country, such as our our liver transplant programs. Some of those are nationally, internationally ranked. And so there are some things that we do, and we do very well here in the state. And university is a linchpin for healthcare in the state.
What about cardiac care? I know that you have been recognized for not only just your clinical care for cardiac disease, but your research in cardiac disease.
Yes, and in fact, at the University Medical Center, we do a lot from a cardiac standpoint. And in fact, I think you know that this medical school is known for its textbook in physiology that actually mapped out the physiology of how the cardiovascular system works. Dr. Guyton was the professor at the time that originally wrote that book, and it has gone through a number of updates and revisions, but it's still published here from the University of Mississippi Medical Center in our Department of Physiology.
Yes.
We also have the Jackson Heart Study, which is the only study of its kind in the world. It was it's sort of the Framingham study that we call sometimes. It's the Framingham study for African Americans.
Okay.
And that study started out a couple of decades ago, and it is continuing to perform. It enrolled a number of African Americans from around the metropolitan area. There have been a number of offshoots of that study, and a lot of there have been a lot of findings specifically about African American cardiovascular health, sickle cell disease, that have come out of that study, because it is a cohort of African Americans and is looking specifically at African American health, physiology, and how our systems work. And so that has been a major study for us here. The findings have been published around the world, and it continues to do great things and provide great healthcare and recommendations for healthcare, and certainly scientific research.
And, you know, I'm glad that you mentioned that. It is, I did a special on sickle cell awareness, and I interviewed Dr. Courtney Fitzhugh, who spoke of that study as well. And, you know, the issue of sickle cell and heart disease. So, you know, we definitely thank these researchers in Mississippi for their leadership and their pioneering research in heart disease. Has the research been affected, or the school been affected because of COVID? And I know what the answer is, but I want you to outline some of these challenges during COVID, and then we'll go slowly to post-COVID. Yeah,
well, we, like other health communities around the country, were impacted seriously with COVID when the pandemic came, and we went through all the different cycles with it, such as when we had a shutdown of the state and we were all sort of sheltered in place trying to hide from the virus, as we say. But we partner with the University of Mississippi Medical Center and the Mississippi State Department of Health, partnered very tightly, and also partnered with Mississippi State Medical Association to try and get out effective communications to physicians and citizens across our state. We actually developed an only partnership of its kind that was in the country with the Medical Association, sort of leading information going out to the public, but especially to physicians across the state. You'll recall that when the pandemic first hit, we had no treatment for it. We had no vaccine. All we could do is try and encourage folks to sort of do social distancing, wash your hand. You remember those sort of preventive things that we were doing, because we had no other options. And that was with the idea that at some point in time, we would get a vaccine. And so we led that initiative for the State Health Department through the Medical Association, and partnering with the University Medical Center. Now, university was under a lot of duress during that time. All of our hospitals were full of COVID patients. A lot of we're rural states, so a lot of our smaller hospitals could not handle that level of severity in their patients. We actually went through a triage process, similar to what we've done in the military. And let me thank you for your service. In a similar fashion to how we would do triage on the battlefield, and I think you
understand
and many of your viewers and listeners understood what happened.
Yes.
But the university was the center that was receiving a lot of the most critical patients, and we ran out of beds. We were out of beds, and we were out of ventilators. a number of those days. And it was stressful on our system, stressful on our state.
Mhm.
It was stressful on physicians.
Yes.
Um,
And nurses.
yes, and I used to remind people all the time, with physicians seeing this amount of death, we were not trained and we were not accustomed to seeing this many patients die on us. That is totally contrary to our training, to our professionalism, how we think of ourselves. But for a number of days and a lot of months, all we could do was provide comfort care and then triage people that we thought could make it, and do those things that physicians do. But you remember that, and that was hard on physicians, and we obviously experienced a lot of burnout. We saw a lot of our colleagues get sick. We saw a number of them die. But university stepped up and tried to provide guidance to
And
physicians
policy.
outside and policy, to at least make it as palatable as we could to try to help get us in the state through it.
Well, let me say what's important here. You are not the only medical system burden. You know, people say, oh, well, what was it? You got around the nation, all points of bulletin in terms of the burden of that, period. Detroit, Michigan, they expressed that. You had surely hospitals out west that take care of, your LA County, your public health infrastructure, large hospital systems. Kaiser even had to step up and review policies as we're facing burnout and people dying. So we just want to be clear, Florida had its burden of the disease. So we want to make sure that people don't say, oh, Jackson had it, had something different. We as a nation, we were all experiencing this. And again, you had to, as a physician in executive medicine, figure out what's best for the physicians and what's best for your care providers, and work with getting personal protection, putting things in place. And then, of course, finally, we get a reprieve with the vaccine. And what do we see in Jackson, Mississippi? What happened on the news? What I remember seeing in headlines was the hesitancy, needing a more patient population, and the glaring headline that your obstetricians had to come out and encourage pregnant women to become vaccinated. I remember that being on, I think, PBS, even, that women who were pregnant in Jackson, Mississippi, and in the state of Mississippi were dying at a higher rate. And tell us about what that was like in terms of understanding that and saying this call to action to get pregnant women in Mississippi vaccinated.
Yeah. Well, I actually got appointed to the governor's task force on for COVID and how we were going to manage it across the state. And so when the vaccine came out, it was always this thought about, well, there's going to be hesitancy because of the history of Blacks being mistreated, the Tuskegee experiment, and all those sorts of things. And so when the vaccine came out and it was available, and the way we were rolling it out with the health department, and the health department being under the governor's office, but we were working with them to roll out the vaccine. And some of those early reports showed that Blacks were getting access to the vaccine at a lesser rate than our white counterparts. And that was something that we had to address. And so we actually started having conversations with the governor and with the Department of Health about that. What we found out is it wasn't hesitancy.
Right, exactly.
For the most part, that was not the primary thing. It was lack of access to the vaccine.
Right.
Because one of the things when we rolled it out, we had a system where you could go online and sign up to get the vaccine. You remember we had the categories, elderly, healthcare. Well, we're a rural state and we have some poor people. A lot of them didn't have computers. A lot of them didn't have a broadband internet. And so they didn't have speed to sort of get them on and let them get an appointment. And so we worked with the health department and the governor, and we said, and then started some of these drive-through vaccinations. And they were set up in places that a lot of impoverished, certainly Black people and rural Black folks couldn't get to. And so we worked with the health department and went to them and said, look, we need to work with the pastors and the physicians, the Black physicians that these folks have a relationship with. And we started setting up vaccination sites in areas that they traditionally will visit. They'll go to their church, they go to their local physicians' offices and all. And so we started setting up vaccination sites in those areas. And what we found out was we then got a lot of Blacks coming through there. We set them up in FQHCs. And we ended up going from being the worst in the country for getting African Americans vaccinated to the best percentage-wise for the population. We went from worst to first. And for a week or two, on a couple of different occasions, we had the best rate for getting African Americans vaccinated in the country. Now, overall, our total numbers were low across the spectrum, but as a percentage of those who got vaccinated, African Americans rose to the top from percentage-wise here in our state, and it was all based on the concerted effort that we did, working with physicians and leaders in the Black community, pastors, and reaching out to those folks that African Americans trust, and then putting the vaccine in the area where they could actually get to it.
Okay, I'm gonna ask you one specific question. The PBS, was that true though, that you were facing a crisis, a maternal health crisis due to the lack of vaccine? Was that an accurate reporting, or you felt like it was overinflated?
Well, that was accurate. We did not have, we had access. We had made it so that our patients could get access to it. Our Black mothers could get access to the vaccine. They, like a lot of pregnant mothers, were afraid to take the vaccine.
Yes.
And that was across the board, but it was certainly an issue here for us. And so we started seeing our ICUs fill up with pregnant women who had not been vaccinated.
Okay.
And so that was actually accurate, but it wasn't because there wasn't access. We had just not convinced them that the vaccine was going to be safe for them and their babies. We also had the same problem with women of childbearing age. And so we did a specific campaign for that population to say that you need to get vaccinated. And we saw in our ICUs, it was only the unvaccinated mothers who were dying. We had our OBs having to do emergency C-sections to get the baby out because we couldn't save the mother. So it was a pretty horrendous time in our OB critical care units.
So, some of the information that, came up from your situation with the moms, actually had encouraged the American College of OB Obstetrician and Gynecologists to issue a statement that all obstetricians, please encourage women to get vaccinated who are pregnant. So that was a very scary time. And that was the only thing. Now, after COVID, so we get things. I'm gonna tell you something that I read recently about one of the challenges, and that's the burn center. That the burn center has taken, the only burn center for the state of Mississippi is now looking at closure. Is that correct?
That is correct. We have had, our original burn center was located in a fairly large but rural health system. And it closed a couple of decades ago. And then we were looking for places to put it. There was suggestions from the legislature that the University Medical Center could take it, but it didn't come with any funding. And you may know that running burn centers are a fairly expensive endeavor. So we kept looking around, and we found in what is now the Merit Health System, a hospital where they started the burn center. Well, it has had the same sort of issues about having enough funding, especially now with hospital funding being in crisis, basically, for being able to afford to keep the burn center open. And so that burn center is closing, and we will have to start sending our burn patients out of the state, probably to Georgia, which is a relationship that we had before we opened the Merit Burn Center.
So the Merit Burn Center was a public privatization of a piece of the university?
No, it was in a private health system.
As a whole health
that had relationship with the university. In fact, one of the university's former professors, plastic surgeon, actually went there to lead that burn center.
There's a lot. So, as what I'm building up to is that, as we talk about the water crisis, which is the next major topic, Hospitals need water. You need water for babies to be born. You need water for, as a tertiary center, for the state, a level 1 trauma center. You have traumas, gun violence up. I do believe you need water for that. And you need water to take care of children. And another big article I read, the crisis has affected kidney transplant, kidney disease centers, your dialysis centers. And that's a major part of health disparity in the Black community. You have heart disease. You know, we talk about obesity. We also know from COVID that Black patients that had renal failure or had that COVID could affect the kidneys. Hence, the patient would need dialysis. I had a cousin that actually ended up being young, but it came and affected her kidneys when she got COVID. And that was a different presentation, total kidney shutdown. Tell us now, in terms of now, we have a water crisis. That phone call I got was from someone evacuating from Florida, because I'm very concerned about family that are in the way of the hurricane. And so, you know, flooding, and now we have a water crisis. This is where we are now. So the conversations are leading with lawsuits. The conversations are leading with EPA. The conversations are leading with statements to and from Mayor Chokwe Lumumba, who I think has a long history of being in the state, since I think he said he was 5 years old. He remembers, I think, a freeze that happened when they moved there, and a water crisis at 5. He remembers that. So, you know, that's how they're leading the conversation. And what I wanted to do was lead with the fact that your medical center, where is it in relation to this crisis? And what are we doing?
Okay. Well, thank you for bringing that topic up. It's obviously something that we have been in the news nationwide and worldwide. Basic clean water and sanitation are primary for what a government does. That's actually how we were able to improve civilization, by cleaning the water and dealing with the sewage. And so to say that we're dealing with that in an American state and in the capital city in the United States here, it's just sad to even have this conversation. But as far as the University Medical Center and some of the other health systems in the metropolitan area here, Jackson has had difficulties with its water and sewer systems for decades now, for various reasons. The university.
You have been in Jackson, Mississippi since.
I've been here since 1988, so more than 30 years. And it has had to deal with that, and we can talk about a number of different reasons for that. But the University of Mississippi Medical Center has its own well system, and it has for a long time, so that it is not impacted with the city's water system goes down. Now, we do have outlying clinics, and one of the clinics is the Jackson Medical Mall, where we do dialysis at. And that system was affected. So what we do in those circumstances, we bring all those patients back from the outlying clinics that are dependent on the city's water system. We bring them back over to the university proper, where we have a well system. Now, all of the hospitals in the metropolitan area, except one, have their own well systems. You got to remember, we've been dealing with this for some time now. And there's one Merit hospital, actually the one where the burn center was, that is not on its own well water yet, but they're planning to do so. Now, I believe that with everything that has gone on and brought this national attention to us, and with the federal government stepping in, that we will get a long-term fix finally. But our health delivery system has had to make sure that it could stand up on its own when these issues occurred, so that we could continue to take care of patients. And because of that, most of them have built their own well systems, and they can continue to carry on providing healthcare services in these crises.
Okay, so you're saying, which is what is not being said, is this is the reason why families are saying they want to sue because of the health implications, potentially that my child may have gotten some lead water, what have you. And what you're saying is that the medical center in itself is providing safe water to families and patients that are workers even. You know,
Right.
you are one of the largest employers of the state of the state of Mississippi. And so that's something to emphasize. Are employees able to get water even if they work in Mississippi and then they leave? Are you a water distribution site within the hospital?
Our employees can get water, but we've actually had so many people around the country and around the world that's provided us and sent us water in that we've not had an issue with being able to provide water to folks who need it, including folks who are at university. Obviously, some of our employees, they work at the university, but they live out in Jackson,
Right.
so they have the same issue with when they're home with bathing and brushing their teeth and drinking water. And so we supply bottled water to them also, and then obviously they can come back over to the medical center in their workplace and get water if they need that. But that's how we have been trying to deal with that. And we actually here at the Medical Association, also the health department and the University Medical Center have all been part of a water distribution system. With getting water in. We were contacted by a large bottled water distributor out of New York about 3 weeks ago to bring down 10 truckloads, tractor trailer truckloads of water, and we set up some distribution sites. And I thought that was a lot of water, and it was going to take us a while to get rid of it, but
no,
we were out of it 2 hours ahead of what we thought our scheduled time to be out would be.
Okay, so let me ask you this. So when we're looking at these areas that are affected, can you give me a geographical understanding of where this is? Are you fine?
Yes, I live in a suburb outside of the city, and so we were not affected. Interestingly enough, that for the past couple of years that we've been dealing with this, and certainly for the past couple of months, in the last month when the system totally failed, there were portions of the city that still got water, had enough pressure. There were other areas of the city, and it became a majority of the city in the last month that had low water pressure. But it has been sort of variable, and if you lived in certain sections of the city, you got, your water was, you had enough pressure to have water coming out of your faucets. You were probably still on some boil water alerts, but at least you did have running water.
Let me ask you, as a longtime citizen of Jackson, Mississippi, do the lawsuits help?
Well, I think that they don't hurt. I think that the thing behind them are to make sure that elected leaders understand and do their jobs. And those folks who are suing, I don't guess I would say I'm an advocate for lawsuits and all, but if it's something that will get the attention of people and see if in fact anybody has been harmed, then if it can help that way, then fine. The city government has a responsibility to provide clean drinking water and sewage services. That's what they're elected to do. Now, there have been a number of things as far as how the state has treated city government, but even, and so there's enough blame to go around. That I believe has been structural racism for the past several decades, and all. And but we have elected leaders who know that, and their job is to find solutions. And so I think the citizens now are saying, you're all to blame. You need to get together, fix whatever the issues need to be fixed, find solutions, do your job, and get these these citizens of America and of the state, get them the clean drinking water that they need. And the time for excuses are long past.
I think that part of, I think that you'll, in terms of going back to the healthcare system, I think that you'll see some things that are that were done in Michigan, whereby you had pediatricians looking for certain signs of lead poisoning or certain signs of even, I don't know, dehydration, malnourishment. That's something that really long-term, I think the medical center could say that they're going to have to add to one of its list of duties. Is that true, you think?
Yeah, that's true. And one thing that I'm very proud of is our Mississippi chapter of the American Academy of Pediatrics have been very involved in this since its outset, with making recommendations across the state about children when COVID was and all that. But certainly as this water crisis has evolved, they have stepped up along with the University Medical Center and sounding the alarm about what people need to do and about how they need to make sure that the children are not drinking the water and the checks that need to be done. And so I'm proud of how well certainly that specialty organization in our state, and how the University Medical Center and the Department of Pediatrics here have done their job with making sure that they're getting the information out that parents need to know about to make sure that they're protecting their children.
One thing that's been in the news, something that also highlighted Jackson, Mississippi, even before COVID, was the arrival of Deion Sanders. And you are very much invested in the success of the university as well. I mean, really, you are, I like to say, you are Dr. Jackson, Mississippi. If there's anything going on in the state, you know about it. You have your advice, and you are sought out for your advice and leadership in different areas, not just medicine, education, politics. So can you update us on what is happening to Jackson, Mississippi, Jackson State University? I'm sorry, GSU.
Yeah. You know, I don't throw this term around lightly, but Deion Sanders has been a game changer here in our state, in this metropolitan area, and for Jackson State University. He has brought a level of professionalism and can-do and expectation for what can happen at Jackson State University. They now have good leadership that's over there that he can work with and partner with. And Jackson State is moving not only the city forward, not only the university forward, but our state forward. Now, one of the things that they had their first game that was scheduled, home game that was scheduled during this water crisis, and he had to move the team to some areas outside because they had no drinkable water or water pressure at the school in their dorms. And he actually managed that very well, and he made some statements about the expectation for a university such as JSU and all the other colleges in the city about what the expectation should be for an educational institution that's training young minds, and for him bringing up these young men about minimum expectations that ought to be afforded that the city and the state should take care of so that they can do their jobs over there. And he has listened to state elected leaders, the city leaders will all listen to him because he's got that stamina. He's earned it, and he's doing great things for Jackson State University. And JSU is on the map. He is going to produce some very high quality young men who will go off. Some have NFL careers, but the ones who may not have that path will be better men than they would have been without having interacted, I believe, with Coach Prime.
Well, let me just say this. You know, people think about football players. Let me tell you that some of these football players may be the next future doctor.
Yes.
Of the state. What he has done is fostered a very intellectual football environment, one that is caring, and one that, given the crisis of COVID, the water crisis, that they can come out compassionate about leading when they get out in terms of healthcare, politics, finance. You know, you have to have that somewhere. Someone put it in your brain that there's more to do than just what you're doing. And I think that's also what you have brought to the state. I can do this, but I can also do more. And you've evolved to be this person that's leading healthcare in Jackson, Mississippi, and all around the state. And again, hats off to Deion, hats off to Lamamba, the mayor. I think that, again, I see him getting spoken to aggressively about his leadership and questioned to about what you just alluded to, years and years of racial and disparities, both infrastructurally and in the healthcare. What is it that we need to know that, you know, on this platform, pushing it out, what is it that you want people to know about Jackson, Mississippi, and this water crisis and healthcare?
Well, what I think I want you and your viewers to know is that Jackson in the metropolitan area is on the rebound.
Good.
We've got the attention of the people now who can provide solutions and resources. And the expectation is that those leaders in this state will work together to get it done. The federal government is going to provide the oversight that it needs to provide to make sure that we're compliant with Clean Water Act and all those things that that American citizens are expected, and it is required that cities and states deliver to them. And then we have our Congressman Benny Thompson,
Yeah.
who has been spectacular.
Right. 20 million.
With,
20 million.
yes,
Asking
yeah.
for? Okay.
He has risen to the occasion, as he does for so many different things, to bring the resources here from the federal government, provide the oversight and the assistance that is needed, that's giving us reassurance that this time things may be different and we may be looking at a real long-term standing solution to this issue. Because again, these citizens don't deserve this. They're paying their bills for their water and the sewage, and they need to be getting what they're paid for, and leaders need to do what they're elected to do. But I think that that's going to happen, and I think we've got we got an immediate fix. We got a temporary fix. The permanent fix is in the planning phases, and I believe we've got what needs to be in place as far as making sure that we get to where we need to get to, that we can have sustainable, reliable, clean drinking water for our citizens.
Okay. And I know that you're saying that the healthcare center in itself is not affected, but again, as one of the largest employers of the state, anybody that could be employed by the hospital could be affected. And, so you do have a vested interest in this conversation as well, from sure that your employees and people are dedicating their lives to healthcare in the state of Mississippi are taken care of. And so with that, I just really want to thank you for making time. I do want a part two. I would welcome Prime Time and Mayor Lamamba to the platform to just kind of talk about some other angle that they feel like needs to be illuminated. You've had my promise to talk about Jackson, Mississippi, the healthcare at the UMMC, and the future of medicine of the state. So I think that's important, and I'm going to continue to bug you. So thank you so much, Dr. Brunson. I appreciate you from the bottom of my heart. I appreciate your service and your leadership.
Thank you, and thank you for all that you're doing to bring attention to these situations, and therefore you're helping with the solution. Thank you much.
We'll be in touch.
Okay.
Bye.